Poor ejaculation is a topic many men are too embarrassed to talk about. But behind closed doors, it's a condition that affects millions, and it's more common than most people think. Whether it's delayed ejaculation, weak ejaculation, or the complete absence of it, the good news is this: it can be treated. In this video, we'll explore the causes, symptoms, and most importantly, the effective ways to treat poor ejaculation, naturally, medically, and psychologically. Ejaculation is a complex process. It involves the brain, the nervous system, hormones, and multiple muscle groups. When any part of that system malfunctions, ejaculation can become difficult, weak, or even impossible. There are three main types of ejaculation problems: delayed ejaculation, retrograde ejaculation, when semen goes backward into the bladder. Weak or low-volume ejaculation causes vary. Sometimes it's psychological: stress, anxiety, performance pressure, or depression. Other times it's physical: diabetes, nerve damage, hormone imbalances, prostate issues, or side effects of medication. And then there's lifestyle: things like excessive alcohol, smoking, drug use, or even too much porn can all play a role. But identifying the cause is the first step toward treatment. Let's start with medical solutions. If a man is experiencing poor ejaculation, the first step is usually a visit to a urologist or endocrinologist. A series of tests will be done: blood work to check hormone levels, ultrasound scans, and possibly a neurological exam. If testosterone is low, hormone therapy might be prescribed. For men with nerve-related issues or conditions like diabetes, managing the underlying disease is key. In cases where medications are causing the problem, like antidepressants or blood pressure drugs, a doctor may adjust the dosage or switch to a different prescription. For retrograde ejaculation, medications like pseudoephedrine or imipramine can help tighten the bladder neck muscles, pushing semen in the right direction. When ejaculation problems are linked to the prostate, such as after prostate surgery, treatments may involve pelvic floor therapy, or in some cases, surgical intervention. It's important not to self-medicate. These conditions require professional evaluation and personalized treatment plans. Now, let's talk about natural treatments. These work best when the cause is mild or functional, not structural or medical. One of the most powerful tools is exercise. Regular physical activity boosts blood flow, improves testosterone levels, and strengthens pelvic muscles. Kegel exercises, typically associated with women, are also beneficial for men. They target the muscles involved in ejaculation and can significantly improve control and intensity. Diet also plays a role. Zinc, selenium, and vitamin B12 are crucial for sperm production and ejaculation strength. Foods like eggs, pumpkin seeds, leafy greens, and fish can help. Reducing alcohol and quitting smoking can dramatically improve sexual function. Alcohol acts as a depressant, lowering libido and dulling nerve responses. Smoking restricts blood flow, which affects erectile and ejaculatory function. Stress is a silent killer of sex drive. Meditation, mindfulness, yoga, or simply getting enough sleep can improve your mental state and reduce performance anxiety, which in turn improves ejaculation. For men who frequently watch pornography, reducing consumption or taking a break can reset the brain's reward system and restore sensitivity, which often leads to stronger responses during real intimacy. In many cases, poor ejaculation isn't physical. It's psychological. Anxiety, fear of performance, relationship problems, or past trauma can all interfere with the body's natural response. Therapy, particularly sex therapy, can be extremely helpful. A trained therapist can help a man and his partner understand the underlying issues and work through them together. Cognitive behavioral therapy, or CBT, is one of the most effective tools for rewiring the brain and reducing anxiety. It works by challenging negative thought patterns that may be triggering the problem in the first place. Communication with a partner is also essential. Open dialogue removes shame, builds intimacy, and reduces the fear of failure. The brain is the most powerful sexual organ. Treat it with care, and it will reward you with better performance. Some men explore alternative therapies, and while results vary, certain methods show promise. Acupuncture has been used to stimulate nerve function and blood flow in the pelvic area. Herbal supplements like maca root, ginseng, and ashwagandha are often praised for their libido-enhancing properties. However, it's important to approach supplements with caution and always check for interactions with existing medications. Biofeedback training, where a person learns to control muscle functions, can also improve ejaculation control. This technique is especially useful for men who struggle with delayed ejaculation, and for couples, practicing techniques like sensate focus, which emphasizes touch and emotional connection without the goal of orgasm, can reduce pressure and gradually reintroduce ejaculation in a low-stress way. Poor ejaculation is frustrating, but it's not a life sentence. It's a signal, a call to understand your body, your emotions, and your habits more deeply. Treatment exists, solutions are available, and recovery is entirely possible. Whether the cause is physical, emotional, or lifestyle-based, there's a path forward. One that can lead not only to better sexual performance but to a healthier and more confident life. If you're struggling, don't suffer in silence. Talk to a doctor, explore your options, and take the steps toward healing. Because every man deserves a satisfying, fulfilling, and healthy sexual life.